Welcome back to Ideagen TV. Today we have with us a great friend, visionary, luminary, and incredible leader, Stacy Haller, CEO of the BrightFocus Foundation. Stacy, welcome.
Thank you, George. Great to see you.
It's great. It really is always great to see you, Stacy, because you're at the edge, on that just incredible edge of innovation and about changing the world, right? We've watched as you have led this incredible organization to help highlight scientists, cures for some of the world's most intractable diseases. And I'm exceptionally excited today by the incredible panel that you've put together that will begin in a few moments. But I wanted to talk and just to highlight and salute you and your leadership, especially during these times across the planet with a global pandemic. Stacey.
It is the most challenging time or unprecedented time that we've been in decades. And if there is a silver lining to all of this, the pandemic has put a spotlight on science and its importance for our well-being. Having said that, I think your audience today will find this panel particularly interesting because they cross sectors in their view and their experience about science and delivery of medicine. And I hope that will shine a light for your audience on new ideas and ways that we can go about doing something to not let this pandemic be one of fear, but something that we grow out of to a better place.
Yeah, Stacy, that's right. And what I absolutely enjoy, and when I've watched your leadership over the years, our former chairman emeritus, the late former Congressman Louis Stokes, was a leader, a statesman, and someone who appreciated in ways that not many people could understand the importance of cross-sector collaboration. And by the way, resilient organizations, companies, NGOs, public sector, all have one thing in common. They work across sectors. And by the way, they also develop partnerships during good times, when things are fine, so that when we have a calamity, when we have things that happen like this global pandemic, they're able to reach out to their colleagues from across sectors or even within their sector, competitors, to talk about here's capacity, here's what we can do, and being able to see around corners. You've had this uncanny ability, and I've seen it, to see around the corner, to be able to see around the corner. And that's what a visionary leader does. They're able to see around corners in a way that helps protect their organization and creates a resilient model, a business model that's resilient. And for that, I applaud you, Stacy.
Thank you, George.
And so we're prepared to lead into this incredible panel. I want to just say thank you, and we're all watching for this bright light, which is BrightFocus, with this incredible panel that you brought today and the inspiration that you're about to bring.
Right. Thank you, George. And I look forward to continuing this dialogue after.
Yeah.
So we can figure out how we can put some of these ideas and talents together to make a real difference.
And one final note, just for your own background, Ideagen is reaching over 7 million people with this broadcast, and just about every country on the planet. So you have a true global audience, and you're going to be reaching so many people that are looking for that inspiration. And they could not have come to a better place to hear from you and your panel.
Well, George, thank you. And I would say the BrightFocus today has about 200 projects globally, with about 40 million in play that is trying to solve some of the most intractable diseases, as you mentioned. And with our population aging, with people who are 10,000 people a day turning 65, diseases that put age at risk become much more critical to address, or we'll have a different kind of pandemic as a result of these diseases. So I thank you for your leadership and for Ideagen that's helping bring people together that wouldn't normally cross paths so that we can find new synergies.
also important just to mention very quickly the 17 global goals. I carry this this little card around, and it's these 17 broad global goals, which include equity, which include the empowerment of women and girls, which include clean water, and wrapping it all together, they include goal number 17, which is global partnerships, which is what this is that you're bringing together today. And again, excited. I want to do a personal shout out to Michael Haller, who will be helping us in the future. He's been a tremendous inspiration. I know he has a relation to you, Stacy, and I wanted to give a personal shout out to Michael for all his hard work last year in Athens for our Global EU 2030 Summit, and to say that we're excited to have him work with us this summer on some other projects.
Yeah, that's terrific. He's excited too. Thank you, George.
Thank you, Stacy.
So it is my distinct pleasure to introduce you to 4 panelists today, where we're going to talk about COVID-19 and the road from here. First, I would like to introduce Cecilia Aradaza, who is the Executive Director for Strategy at the communication agency Wandros. She is helping NIH with one of the most important projects called an All of Us initiative, which is an outreach to a huge part of the population and to engage in efforts to improve personalized precision medicine. Prior to this important position, she ran communications and outreach for the Biden Cancer Initiative. Welcome, Cecilia. Next, we have Dr. Scott Kaiser. He is a practicing geriatrician whose work includes being the Chief Innovation Officer of the Motion Picture and Television Fund, which provides over 150,000 people each year with healthcare and aging services. For due diligence, both Cecilia and Scott are members of the BrightFocus Board of Directors. Hi, Scott. Welcome.
Thanks.
Phyllis Farrell is the Global Head of External Engagement for Alzheimer's disease and neurodegeneration at Eli Lilly and Company. She is a widely recognized authority on the challenges facing drug development for an aging national and global population. We are thrilled to have Phyllis with us as well. Hello, Phyllis. Rounding out the panel, we have Dr. Clark Lagarius, who is a distinguished professor of biochemistry at the University of California, Davis. He was elected to the National Academy of Sciences in 2001, one of the highest honors accorded to a scientist or engineer in the United States. So Clark, welcome to the panel. Great to see you all. So let's get right to it. And as we go on, please elaborate a little more about the initiatives you're all involved with, because I think they'll be informative to the audiences that hear, and who knows, maybe we'll spark the next innovative idea or collaboration through our discussion today. So let's start with the first question. From your perspective, Cecilia, what has changed because of a pandemic as you think about it in health and science communications and the way the public is relating to the pandemic?
Thank you, Stacy, and thank you, Ideagen, for hosting these important conversations. Thrilled to be part of this panel. Fundamentally, I think how we communicate has completely transformed, right? We see it every day. Our lives are literally kind of connected on screen, and our off-screen lives have become kind of our own isolated spaces. How we share information, how we take it in. We went from digital as new media to now having only digital. And as we have been physically distant, we're still finding new means to stay connected, and some might be able to say in much more, effective ways. Communications has become very, very personal. For the first time ever, almost everyone we communicate to and with is at home. So as you're talking to them, you're literally in their personal space. And we just talked about this earlier. We're all in unusual spots as we even have this panel. This gets even more amplified when it comes to health communications. With COVID-19 upon us, health became utmost priority, right? Like we talk about public health data at the dinner table. We try to understand comorbidities, how this pandemic relates and correlates with other diseases. We weigh risk and benefit every time we go to the grocery store. These are the behavioral structures that we are now recalibrating. And health has not become just it's become a lens from which we view the world. And the spotlight, as you had mentioned, has really been trained on science as a solution. So the baseline understanding for how vaccines are made, treatments have how treatments are pursued, that has phenomenally increased. So there's great and very tangible support for science, which is an enormous opportunity to really kind of not just accelerate the process, but really kind of double down on research as hope and kind of research as part of the progress we want to see. And I think an important piece to this too is this pandemic continues to challenge us. And I believe we continue kind of to step up and respond to it in an effort to stay connected, to stay informed, and stay vigilant in the face of just so much turmoil and unknown around us. And so fundamentally, like how we're continue to communicate continues to evolve. And I think we are creating kind of not just this new normal, but just a new way of doing things as we move forward. There's no going back.
Cecilia, we're going to come back to that a little later about what you think is going to change. But as we continue, let me bring Clark in to talk a little bit about, from his perspective as a scientist and someone part of developing understandings of the world in which we live from a scientific standpoint and how we engage. From your perspective, what do you think has been changed because of the pandemic in your industry and with science?
Thank you, Stacy, for the invitation. I really enjoyed being on this panel and I'm honored. As a university professor, the first and foremost is teaching online. That's changed. In March, when the pandemic was rising, I was told that my lab course was going to go completely online. Now, how do you do a lab course online? That's crazy. And so I set up to learn a lot of the online methodologies. So the need for innovation in this area is never greater. Zoom and Slack became new words to me, and I started using these methodologies. I call it Zoom Slack-a-lacka. And then Canvas, Piazza, and many others. So all these things are new. And it's very difficult to do online because every question that you get is reiterated by hundreds of students. And when you have to write an answer online, you make a mistake, then you have to correct that. So the second thing that I see has changed is collaborations have exploded in science. As a researcher, as well as a teacher, groups of scientists I see around the world who have always collaborated and have now come together at unprecedented rates. And they're throwing aside bitter rivalries to work together to solve an emerging problem that's immediate. And so solutions to finding vaccines, solutions to finding new drugs, and other types of therapies are, people are trying to rapidly, adjust to this. And, I'm teaching a course on drug development, and the idea is to repurpose drugs that are already available for human use. Otherwise, it takes nearly 10 years to get a drug from discovery to the market. So online journals are now publishing immediately, even before peer review. So there's a journal's bioarchive, for example. People are putting out their data immediately. And this is, available to all over the world. So I see collaborations between scientists to work together, and industry rising to the fore.
Incredible. You know, it begs the question, so that we'll get into later, which is, given the fast moving of change, which no one ever really likes to accept, how might these experiences better our delivery and our living post-pandemic? So we'll get to that after. And so I want to bring in Scott Kaiser, who is treating patients, seeing patients, and living through the pandemic in a way very few of us have directly experienced the disease and the caring for patients. So Scott, I would ask you, as you look at the pandemic, what has really changed from your perspective?
As a geriatrician, this is a unbelievably intense time when you have a pandemic that's disproportionately impacting older people and people with chronic conditions, right? So that's sort of our bailiwick of what we deal with, older people and people struggling with chronic conditions. And so we've been fighting this battle on multiple fronts. One, on the front line, at Motion Picture Television Fund, we have a retirement community that includes a nursing home. And on our campus, at our nursing home, we've had a COVID outbreak. Unfortunately, 6 of our residents lost their lives, while many others were infected, and along with staff members infected. So saw it right up front, and struggled with the challenges around staffing, personal protective equipment, testing, significant lack of access to testing. So saw that right up front, but at the same time, also dealing with the battle on other fronts. For example, even before COVID, we were dealing with the loneliness epidemic. The fact that so many people around the world, but we have a particular sort of situation in this country where people are just feeling disconnected and feeling this profound sense of loneliness, which impacts people of all ages, but certain groups are disproportionately impacted, including older people. And that feeling of disconnection, something like equivalent to thirst if you're craving fluids, or hunger if you need food sustenance. People are feeling lonely because they're, as a physiologic response to needing meaningful social connection. And it turns out that that's something that is particularly problematic for your health. People who are chronically lonely have an increased risk of health problems, functional decline, and even premature mortality. The health risk has been compared to smoking almost a pack of cigarettes a day. So even before COVID, we were dealing with this loneliness epidemic. Now, all of a sudden, as a geriatrician, I'm telling all of my older patients, stay home, even before stay-at-home orders, avoid other people. So now, whereas we had so many people who are isolated, we have, you wouldn't believe the numbers of how many seniors live alone, now completely cut off, maybe going days without talking to another person. So we've come up with all sorts of solutions to address that, to help even, you know, as we're socially distancing, which we need to be doing to protect ourselves from the virus, even as we're doing that, working to keep people safe, connected, and even engaged, and along with that, engaged in managing their own health and well-being, which is so critical always, but particularly now. So seeing this battle on multiple fronts, I think something we'll probably come back to in this conversation is just the fault lines that this has exposed, and really gives us some clear directives for a better path forward, particularly as we move into our next normal and build things back.
Thank you, Scott. Very thought-provoking, and I'd like to round out the first question with a discussion. And Phyllis, you have the advantage. We've talked a little about the communications and the science perspective and what's happening on the front line of medicine, and particularly with an aging population in there. One of the things that also often doesn't get brought in is the perspective of the industry that's trying to develop medicines to help us live longer and live better. So I would pose the question to you as well. What from your sector have you seen that's really changed with this because of this pandemic?
Thanks, Stacy. I'm really honored to be part of this panel. I think I might actually be learning more than I contribute, so I appreciate the invitation. You know, I think a couple of things have happened. Cecilia already mentioned, you know, really science being at the forefront, and I think it's wonderful to see, you know, I've been in pharma 25 years now, and to really see that the whole lay community is embracing research and development, and how science is really going to be the way we get through this pandemic. That being said, you know, Clark and Scott have talked a little bit about the frontline medicine. When we think about clinical trials, and specifically Alzheimer's disease research and development is where I specialize, clinical trials have been dramatically impacted because we can't always have people visiting trial sites now, especially if those trial sites were part of a hospital, place that is now providing care in the face of this pandemic. And additionally, when we think of Alzheimer's disease research and development, we've got the added challenge of we're already serving a vulnerable population. So one of the things that I think will ultimately be a benefit of what we've had to learn is, you know, necessity is the mother of invention. And we have needed to very quickly find out, how do we do some of this research more virtually? Do people really need to be at the clinical trial site in order to take a memory test? Are there some things that we can do, say, you know, blood sample collection? Can that be done in someone's home where a nurse is going to them rather than that individual being exposed by coming to a hospital or a clinical trial site? These are things we'd always wanted to do because it would reduce the burden on a clinical trial site, reduce the burden on participants, people who wanted to participate in research but maybe struggled with transportation or something along those lines. And it's really forcing us to do those things. So those are things that I'm really hoping that not only do we innovate around, but we keep the innovation. The point I'd like to really reinforce that Dr. Kaiser made is that we always knew that there were gaps in our healthcare system as people age, but certainly COVID-19 has identified for us the dramatic gaps we have in our healthcare system for caring for people as they age. Stacy, you mentioned the number of baby boomers, 10,000 a day that turn 65. What a tragedy to think about how well we've cared for other organ systems, other diseases, only to find out that as we age, we're not caring for our brains the same way. And so I think it would be a huge travesty and honestly dishonor the lives of people that were lost, family members that were lost in this pandemic, if we don't take this opportunity and make sure that we plug those gaps in the healthcare system, that we actually make sure that we're caring for people as they age. So not only are people aging, living longer, but they're living healthier, happier, longer lives. One shift I'd make, just which I don't think has necessarily been addressed yet, is to think about what it's like to be a parent, a caregiver at this time, whether that be caring for an elderly parent. Dr. Kaiser mentioned isolation. It's just horrible to think about being in an elder care situation and not being able to hold the hand of your mother or father, but also being a working parent how do you do Zoom calls when you're trying to juggle e-learning, and the amount of stress that that's putting on our workforce. And so I'm also very hopeful that as we learn some of these new technologies, we learn to give each other some grace as we have children and battles with lessons, or even just fighting with our Wi-Fi bandwidth, that we learn a lot about each other as people, and we move forward those learnings too.
Thank you, Phyllis. So as we have heard from 4 different sectors about the pandemic and what's happening, I'd like to have you think about what you've heard from each other and talk about what you would like to see as a new normal, or the takeaway from the industry. You know, Phyllis, you talked a little bit, and all of you really talked about this fragmented system that we have. Although people are pulling together, they're pulling together in crisis. So the question is, in these new learnings and around innovation, what might we take away from this to be something we could build on to do something, so the pandemic ends up opening more doors to a better tomorrow? And I'd love to hear from each of you a little on that. So let's go back to Cecilia, and let's go back and forth and add on to each other in this section.
Sure. I think I want to build on something that Scott had mentioned about the pandemic exposing fault lines. And I think it's so important from a learning perspective to make sure that we don't just acknowledge these fault lines and then get back to norm. I think, as I mentioned earlier, there's no going back. What we have to do now is to really define what next looks like. And I wanted to draw attention, for example, to a really stark issue that's in front of us when it comes to health disparities. We're seeing it play out with COVID incidences, but it's important to understand, like, these are not isolated to COVID or pandemics. I mean, these are fault lines that have existed for decades and generations. And so now that it's exposed, it's front and center, as a nation, we need to grapple with these. And what I'm hoping we all can do, and this is the royal we, right? It's everyone from decision makers to influencers to advocates, everyone touched by disease or diagnosed with a disease, to say, one, it's not okay that these disparities exist and persist, and we need to kind of muster up the courage to really solve for this in ways that are resilient and sustainable. And I think that's a piece that I wanted us to think about in terms of learnings and what to do next is really tackle the fault lines that we are seeing and do it with the vigor and the kind of the urgency with which we're all now facing, because time is kind of, our notion of time has completely changed. So,
right. And so is our resolve.
Absolutely.
Yeah,
Scott,
I can jump in here. Yes, Cecilia, I just couldn't agree with you more. And each of you made such great points. I mean, even before this, of course, we were dealing with the fact that your zip code has way more to do with your genetic code as to how well you'll live and how long you'll live. I mean, massive disparities in life expectancy from one side of a city to another. And this has just made it worse, right? We have older people, we have minorities dying at greater rates. I mean, this has made just absolutely amplified health disparities. So what do we do going forward? Are we just going to have more of the same? Or are we going to actually build back a better system where we start to address some of these issues? It's an open question. It's to be determined. What are some of the things that we would need to do? Well, one, we have to really invest in prevention and understand this intersection between so many social factors and our health and well-being, and have a system that actually reflects that, right? Because even now, we find, a rush to get testing back in acute care facilities so that they can reopen non-essential surgeries, really for revenue, which I understand hospitals have to survive, but is that really the top priority when we need testing out in an active pandemic. We need to really understand the connection between community and health, and that building health is about building community, but we don't necessarily have a system again that incentivizes that. Even with the explosion of telemedicine, fantastic, unbelievable. I like so many of my colleagues, I don't want to go back. I want to make sure that all of my patients have access to primary care and specialty services through telehealth. Now, let's look at this a little more closely, though. For billing purposes, you have to have the video component to have a higher payment. But is that really necessary? There's a lot of care that the good old-fashioned telephone could make a huge difference. And with a lot of my patients who struggle with the technology component, they really prefer just a simple phone call. So how can we do that where we can manage chronic conditions using the telephone? How can the incentives be aligned to just make sure that we're doing the best possible care that's focused on prevention, that's focused on properly managing chronic conditions? And then finally, something I know we're all passionate about, my hope that science can lead the way. You know, and science for finding new cures and better paths forward. But even science, when we look at these disparities directly within health or within our broader social fabric, when it's police brutality and just terrible racism, what's the way forward? Well, there are people who actually study this, who can show us the way forward, that there are better educational opportunities, there are better training, there are changes we can make. But point, it's an open question. It's to be determined. But the hope for me, the hope is that we will actually turn to scientists and experts and legitimate fact-based truth for a better way forward, right? When it comes to health disparities or broader disparities out in our community, or any one of these particular problems that we're all so passionate about, from climate change all the way down through maternal child birth issues, the whole, from the most micro to the most macro, that there are people who've dedicated their lives and continue to dedicate their lives to understanding these problems and being able to show us a better, more rational way forward so that we can actually begin to address them and make a difference, and not just have more rhetoric around them that's not going to get us anywhere. We need bright minds to come together. We need to support people who are doing this hard work to actually get us out of these problems and find a better way forward so that we can build back better.
Thank you. Clark, would you like to add to that from the perspective of when I hear what Scott's saying? I think about change is most easily achieved with early stage careers and people just starting out in they're more open. Something happens to us, right, as we seem to age, that our risk taking and our ability to be open changes. So I'd be interesting to understand from your perspective as well about all of us talking about, we're here today because we want to build back better, and we want to see in each of our sectors positive change and adoption to things that are really working, that I guess we're all shaking our head a little because we're saying, why did it take this to get us to move in telemedicine? Why does it take what's happening today for us to realize that we need to pull together, and working together is a much more energizing, de-isolating experience than staying the way it's always been, and to be more open to it. But it'd be great to hear from the student working with young students and their optimism and how they might be the catalyst for change more than another generation.
Yeah, thanks for bringing that up. I mean, I see that the students are the future, but they're watching this dismal news and that sort of thing, and they're getting rather disillusioned when they graduate. There's going to be no jobs, no places for them to go. But I see encouraging students to get in the field of science and there's a great initiatives to get students of all backgrounds into science, and they've been turned away from science by elementary education, by teachers who don't have science educations themselves. They may be trained in education, but when it comes to science, they open up the textbook and don't know what they're talking about, and the students get this perspective of science that's really not helping them to think of that as a career. And to think of something as a career, you want to think that these are people who are respected. These are people who are working toward the public good. And all the scientists I know, that's what they are. But, you know, we have views from various sectors of the world that scientists are evil and they have an agenda and they're working with viruses to make deadly viruses and that sort of thing, and all this misinformation in science. And so I'm hoping in the perfect world that, you know, the people come together and look at scientists as heroes, just like the frontline workers and the military service and that sort of thing. This is a respected career, and many of us work behind the scenes, and we're not out there proselytizing the public, most of all, and not good at speaking in public. And we tend to come off as, you know, like erudite, and, you know, I don't want to listen to that person. He's brandishing his credentials in front of us. So I see the need for science funding to go to basic research. We've seen with this pandemic that funding can be, scientists can be rapidly deployed to work with a pandemic, and it brings out the best of people to work together. But the long-term solutions, for example, infectious diseases that are developing, we know about a lot of these in the bats, and people could be working on these and anticipate a pandemic that jumps to humans, and develop the tools to understand the viruses and even develop vaccines. So I see that I want to urge participants to put more thought into supporting basic research and supporting your children to go into science.
Thank you. Phyllis, the area that's often the target, which is at the other end, which is making drugs or developing drugs, and why does it take so long, particularly as it relates to clinical trials? Because at the end of the day, getting a treatment to either slow or end a disease is part of what science is trying to do across the board to make our lives better. So when you think about sort of what we've been going through, what are some of the just ahas that have come away from this pandemic and all the battles we've been in to try to help different agencies and other sectors understand it doesn't have to take this long, so that we can get treatments out sooner? Any thoughts on that?
Well, you know, a couple. One is, I think, you know, Clark mentioned kind of cross-sector collaboration. We might call it public-private collaboration as well. And I think actually in the case of Alzheimer's disease, we've really benefited from that. We really have scientists that work extremely well across the private sector and government. And I think there's lots of good examples of that. I think one of the things that's been extremely challenging in Alzheimer's disease research, and this is for all types of studies, whether they were government funded or industry funded, is that patients are not flowing through our healthcare system in an efficient way. And what do I mean by that? I mean that people are not getting diagnosed very early in the disease. And we know now that symptoms actually happen 10 to 20 years after the pathology begins. So in the academic and the basic research and the early phase research, even in industry, what we've learned is that we need to study this disease. We need to treat Alzheimer's disease very, very early in its progression. And yet our healthcare system has been designed for diagnosis very late in the progression. And so I don't think we can think of a single disease that is better off when we treat it late. Dr. Kaiser mentioned we need to think about prevention. Imagine we wouldn't be successful in cancer if we didn't start treating any cancers until stage 4. And yet that's what we're doing in Alzheimer's disease. I think it becomes a real problem when we think about health disparities and the fault lines that both Cecilia and Dr. Kaiser mentioned. And what do I mean by that? And why is it such a problem? Well, the lack of an early diagnosis leaves the family without support resources, and it makes the burden much, much higher. Well, guess which families are least able to handle that burden of that diagnosis? It's the ones where you've got 2 working individuals, or maybe a single parent, maybe someone taking care of elder care and children. They don't have a lot of savings to deal with crisis or at-home health. And so we've really exacerbated the health disparities by waiting for this diagnosis to happen so late. So one of my ahas, you asked the question, Stacy, I was listening to a podcast, my new thing. I walk the dogs and listen to COVID-19 podcasts. And one of the things that I'd heard was that in this pandemic, the front line is actually all of us. And it's our willingness, whether that be to wear masks, socially distance, go along with regulations. We're the frontline healthcare workers. But in Alzheimer's disease, we've been the frontline healthcare workers for a very long time. And the last numbers I saw in the US is that we have over $200 billion in unpaid caregiving that's happening associated with Alzheimer's and dementia. Imagine, as we're reopening our economies and trying to figure out how to fix what's happened, if that $200 billion could be in our GDP. And so I know Ideagen is all about big ideas, and I couldn't tell you that I have an exact answer about how to make that happen. But boy, if we've got the right brains in this summit to be thinking about how do we make a pivot so that we provide support to families with a timely and accurate detection and diagnosis. Let's think about brain health. Let's provide that support to families, and let's find a way for that unpaid caregiving to actually be caregiving that supports our economy. I think that'd go a big step in the right direction.
Right. Absolutely. Scott.
Yeah, Phyllis, you have my vote. First of all, anything, you have my vote. I couldn't agree with you more. And you said something about the early diagnosis. It's unbelievable. I don't know if people appreciate, in my practice, trying to screen and provide early diagnosis, there's actually tons of pushback from my colleagues, with this attitude, this fatalistic attitude of, well, why? What can you do about it? There's nothing you can do about it, which is really counterproductive. And we do need to focus on earlier diagnosis. It's so essential of neurodegenerative illness, Alzheimer's and related dementias. It's a must. But there was also something else that you mentioned that stuck out to me there, about your aha moment of all of us being the front line. What's so amazing to me about this time is how it's crystal clear that it has to be both. We need grassroots collective action, right? I run programs where we have volunteers who are making phone calls to isolated, lonely older people, and those phone calls make all the difference in the world. And you see this over and over again all across the world, with people stepping up to help get groceries, and people wearing masks, and people playing their part, and people helping each other. And you need that. And at the same time, we have these massive problems that don't acknowledge borders, these arbitrary borders between countries that don't silo themselves, that we need huge coordinated efforts across institutions to even begin to penetrate. And so it's just, we are living in a time where it could not be more clear that we need both. And that's why I was so glad to hear you talking about the public-private partnerships and the kind of collaboration that I know you to be involved in, and that I hope we spark others to become involved in through this discussion.
You know, Scott, I'll send you a link to a manuscript that just came out in the Journal of Alzheimer's Disease, which you'd probably be interested in. It might actually help you with some of your colleagues. We looked at some cost data, and, you know, I don't think it surprised anyone that people with Alzheimer's disease cost Medicare more than someone without. And that, by the way, is not in treating their brain health. That's the fact that, you know, it's very difficult to manage your diabetes, for example, if you're having cognitive challenges. And I don't think it surprised anybody that the costs increase as the disease progresses. I think what really surprised us was that the healthcare utilization cost of the caregiver, and, you know, often the caregiver is also a Medicare beneficiary. That cost went up very, very early in the disease, in the stages of mild cognitive impairment. And you know what that's probably showing us is that those are caregivers who are trying to do it all on their own.
Right.
And as a result, it's impacting their care. When my father was diagnosed, our doctors told me, you now have 2 patients. Because, and it impacted my mother's health negatively. And that was me knowing what I should be doing, and I still wasn't doing it fast enough. So I think we really can wrap our arms around families earlier in this. And, you know, I know a lot of people are a little fatalistic or nihilistic. We actually hear about doctors talking their patients out of participating in clinical trials because, you know, nothing's ever going to work. But that's not true. We've made so much progress. And most of the time I have people tell me, I wish I'd enrolled in a clinical trial sooner, because I felt like I took power. I felt like I took control back from a disease that, you know, had taken away some of my integrity and my own brain health. And so we can do this now, and we can do a better job of it now. And I'd be more than happy to share that link with you. But thank you for fighting the good fight, because you're the one on the front line. I'm not.
Well, you are too. As that doctor said, you had 2 patients. He should have said 3, because
You are right.
Right? I mean, caregivers are really fighting this fight. And now, to bring it back to COVID-19, everything's just 10 times harder, 10 times more real, 10 times more fear, anxiety. And so being able to offer people access to meaningful self-care so that they can better care for themselves and for their loved ones, I mean, we really, we have a long way to go.
Stacey, I also wanted to build on a point Phyllis just made about participation and the value of that. And I know this is something that BrightFocus especially is really keen on, participation in clinical trials. And that idea of really empowering everyone to take a role, right? Participation is power. It's not in the same way, you know, collaboration is no longer a goal or something that we can aspire for. It's collaboration, these partnerships, it's not optional anymore. We're seeing these kind of happen in micro doses where we live, work, play, pray, learn. They're all converging, and we are teachers and running, you know, to our kids, and caregivers to our parents. And, you know, I'll often say I'm the lunch lady all at once, depending on what's the time of day. And these are the moments that really kind of push us to, you know, it's interesting because often societies change when there's like something that's like disruptive innovation, like the internet or something along those lines. But right now the disruptor is so much bigger and so much more powerful with COVID. But it also means that the innovation that happens alongside it could kind of step up to that vast kind of opportunity that's upon us. And I also wanted to kind of build on something that Clark had said about the importance of basic research. And one thing that is kind of quite phenomenal at this moment is to look at the open science movement, right? For so long, when you look at clinical research information in back to Scott's point about like, look at science as a solution across the board, look at facts, look at data. Well, journals have made data available to all things that are COVID-related research. This is unheard of in years past. This movement has been decades in the making. Now we have to make sure that when the time comes, when we move past COVID, that we don't go back to kind of putting up paywalls all over again. Like this data that allows science to move forward needs to be accessible across the board, because it's part of what will make the next generation of scientists not only kind of excited about the future, but like have access to and not spend time reinventing the wheel. I think there's just so much there.
Right.
Yeah, and if I can butt in as well, I mean, the shared resource developments between academic and industry and government is really essential. I mean, a lot of stuff is siloed away in university servers and in corporate things, because the corporate vaults, because of IP protections and that sort of thing. And there needs to be more sharing of resources, because we're redoing things over and over again that have already been done. Experiments have been done that aren't available to other people that would speed the process.
Thank you. Thank you all for the Ideagen audience. I think we've covered so many different areas of opportunity, and we hope that we've provided you with some new ways of thinking about what you do and how we might reach out and make a difference together in any one of the areas that we described would be huge, so that we don't return after the pandemic, but we're better, stronger for it. In closing, I'd like to ask each of you if you would talk about how the pandemic has changed you, and what one thing are you likely to do differently yourself? So let's start with Clark.
What am I likely? Well, I'm going to retire. And when I retire, I'm going to remove my title and my degree and go out there in the world and go on buses and, you know, just local stores and meet with people of all walks of life and have a ability to sort of interject a little bit of science-based, or let's say evidence-based decision-making, because there seems to be a need for that, but people just don't realize it because they're turned off by, you know, someone's credentials. And so that's what I'm hoping. It's a time's up, I guess. That's what I'm hoping to do in the future.
Right. Thank you, Clark. We'll go next to Phyllis. How has this changed you, and what one thing will you do differently?
I think the big change for me is I'm appreciating some little things that we got too busy and too scheduled to appreciate. That could be anything from taking a walk, enjoying the outdoors, enjoying my family. And so one of the things that I really want to do differently is not let us get to that, you know, fast. I've got to be busy all the time, and make sure that I hold some space to just be appreciative and not lose this perspective. I think it's probably a silver lining in all this, that we're all enjoying being still a little bit.
Right. Scott?
Yeah, I mean, I think it's a little too fresh still. Everything's dynamic, rapidly evolving still. So I haven't really had that sort of space to reflect. I'm not sure. I feel completely changed and don't really know how to interpret it all yet. There's just so much going on to this day. I agree that taking time, slowing down, certainly thinking about, you know, unnecessary movement and travel, but at the same time, I just feel that I have a new sense of urgency, sort of fierce urgency of now that I cannot let go of going forward. I think the amount that we've been able to bring people together, the amount we've been able to accomplish, I need to keep doing that. I think that my personal criteria of what's meaningful in terms of how I spend my time, and the output and outcome that it'll result in has changed significantly.
Thank you. Thank you, Scott. And Cecilia.
Thanks, Stacy. Thanks, everyone. So inspiring. I think definitely appreciating and finding joy and energy from kind of the mundane, quiet moments, right? And making time for what matters most. I've also been really personally, and as a family, we've been thinking hard about the big problems that are now in front of us. Like, these fault lines have been exposed in a way that we're forced to really kind of face it. And I'm challenging myself to not shut it off. It's so easy to switch screens, to turn down the volume, to kind of live in a safe bubble that you can create for yourself. But how do you not do that and not retreat in your safe zone and really kind of figure out what it means to be part of the solution, whatever that might be, wherever you might come from. And I think that's a issue that continues to be for us.
Well, but on behalf of BrightFocus and Ideagen, I want to thank you all for your time and your thoughtful conversation and exchange. I look forward to what I believe will be this is the beginning of many more conversations as we unwrap sort of what we're all living through to a better day tomorrow. And for our viewers, we'd like to conclude by offering to you to join us at BrightFocus, where we will hold a free online screening of the award-winning documentary on Linda Ronstadt, The Sound of My Voice. The film follows the career of the legendary singer who was forced to retire early due to a neurodegenerative disease. Before the film begins, you'll hear from producer James Keach and from 4 of our BrightFocus scientists about their hope for a future free of diseases of mind and sight. I'd like to invite you to take a break from all that we're experiencing these days and enjoy the great music and the wonderful performers that share their stories and experiences with Linda. It's a wonderful movie. Join us, sign in. It starts June 4th and runs for a week, and it's a great respite from all that we're living with every day. And share it with your friends. BrightFocus is happy to include you in this. Thank you.
Baby, you're no good. Linda could literally sing anything.
Would you welcome, please, Linda Ronstadt.
Linda was the queen. She was like what Beyonce is now. Feeling better now that we're through.
She came to LA when the rock and roll scene was in gear and was going. It was the place to play.
Linda was a very determined woman.
I knew she was going to be a big star.
Linda is such a perfectionist. She's a pain in the ass sometimes.
She was the only female artist to have. Winner is Linda Ronstadt. It was like, hey.
Yeah, baby. She was the first female rock and roll star.
I tried following Linda Ronstadt every night. But people didn't notice the difficulty of being a woman, trailblazing, and having the success of a Mick Jagger.
The rock and roll culture seems to be dominated by hostility against women. What happens is that they lose the ability to focus on themselves as a person rather than as an image, you know?
I've been cheated.
There was a certain amount of banding together with women.
Linda had a lot to do with lifting me up.
We were throwing away all those conventions. When we heard our voices, it was like a high like you've never felt.
She wanted to sing everything.
Opera, mariachi.
My family are Mexican, and that is my roots.
They always told her, you'll ruin your career.
I'm going to do this just for me.
She did it anyway.
As time went on, there was something really wrong with my voice.
Nobody could handle change or adjustment in a more thoughtful way than Linda. She was just a sweet, humble person.
There's just no one that will have a voice like this.
When will I
be. Love